Hey, Spoonie fam. I promised to explain to you the whole story behind what happened with seeing the second doctor at the pain clinic, because it was amazing. If you've watched my videos up to this point, you know that I have been dealing with what the majority of most chronic illness patients deal with, which is a lot of doctors that dismiss and gaslight and ignore, and had been to two pain clinics, both of which the first one basically just ignored me, said that there was nothing that they could do for me. And then I went to a different doctor. The hair's like kind of, ooh, hello. I went to a different doctor at through the same group. And he just was trying to push procedures down my throat. He wanted me to get SI joint injections, which is contraindicated, come to find out, for people with Ehlers-Danlos. And then he wanted me to have some type of a spinal procedure done, which I'm not even like, yeah. Anyway, so I had told myself that I was just going to give up. I was just going to have to learn to deal with the fact that I was going to be in pain for the rest of my life. Then I had been doing some more reading, and then I got kind of angry. I mean, honestly, at the fact that with the different conditions I have. So I've been diagnosed with Ehlers-Danlos Syndrome. I've been diagnosed with psoriatic arthritis, and I've been diagnosed with fibromyalgia. So with fibromyalgia, there is no treatment for fibromyalgia. Pretty much it's pain management. With the psoriatic arthritis, I am now taking Cosentyx, which I just started. I did my second injection this weekend. I was going to do an injection online or, in a video with you guys. And I don't know why I was super nervous about it, so I didn't do it. But anyway, but that takes a while for it to work. So that, Cosentyx and pain management. And then for Ehlers-Danlos syndrome, it's physical therapy and pain management. So I have been in physical therapy now for months. I take supplements that cost me a couple $100s a month. Trying to combat the inflammation, do anything and everything, make sure that I'm getting things that my body could be missing that could be contributing to my pain. So I just kind of wanted to go in and have my say. I wanted to advocate for myself. I wanted to be like, hey, these are the things that are treatment for my conditions, and I'm doing my side of the bargain, but y'all are like not doing crap. But I didn't even have to get to that point. Like, as soon as I started explaining what's happened in the past and what I experienced with the other doctor through their practice, she immediately apologized to me. And she said, you should have never gone through that. You shouldn't have been treated that way. Let's get your pain under control. And I was like, I'm sorry, what? And then, we were discussing, how COVID kicked this all off for me. And before I could say anything, she was like, do you have long COVID? And I'm like, yeah, I was diagnosed with that as well. And then she was asking me all these other questions, like things that I have mentioned to doctors before that they've just kind of rolled my eyes, their eyes, like I'm inventing things or I'm making stuff up. And she was like, oh yeah, it does da 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 da. And I'm like, yeah, okay. And then I was explaining to her that it's super common for the only two, because I've tried several pain medications that I'm allergic to, opioid. And then I've tried the alternate pain things, and none of them have worked for me. Some of them have had horrific side effects with. And I said, I took a chance of saying that it's super common with people with Ehlers-Danlos that the only medications that work for us are tramadol and Dilaudid. Before I could even get it out, she said tramadol and Dilaudid. Like, she knew. I don't know. My husband and I cried multiple times during that visit because he was just happy for me, and he sat back and seen the way that I've been treated and feels horrible because, as my husband, he wants to protect me. He wants to make everything okay, and he can't. And for me, I was, like I said, getting myself to the position where I have to accept that I'm going to be in pain for the rest of my life. This is just the way it is. And to have a doctor listen and to have a doctor say, hey, we're going to treat your pain. We're going to do whatever we can to make your life bearable, to give you quality of life. I'm shocked. I'm shocked. She started me off on a very low dose, obviously, because we have to, find what works for me. Although I've been on this medication multiple times, throughout my life. And I know what dose usually works for me, but we just have to jump through all the hoops to make sure that we're doing everything correctly because of all the DEA stuff in this country. That's a whole nother TikTok. But what we're hoping for is to get me to the point where I can take the extended release and then have backup dosage for breakthrough pain. So right now, the dose that she has me on, it's taking the edge off, which is, I am so grateful for even that. I have been in so much pain for so long. That being in a reduced amount of pain is awesome, which sounds really weird, I know. But and it's wearing off really quick. So definitely the extended release is going to be the way to go, and probably a higher dose. But we'll stick with this for a couple weeks and see how it goes. But anyway, that's my update, and I just wanted to let you guys know I'm super excited. And don't give up, guys. Advocate for yourself. Go to different doctors. If you have to find an advocate to go with you to your doctor's appointments, do it. But we have to demand that we get the care that we deserve, because we do deserve it. You deserve it.